Patrick Cobb, MD, a community-based oncologist in Billings, Montana, was recently elected to the position of President of Community Oncology Alliance, a national advocacy group for cancer patients and professionals. Dr. Cobb joins me this morning to discuss the campaign that's been launched here in the nation's capital. Good morning. Welcome to our program.
Thank you, Gloria. Thanks for inviting me.
And thank you for joining me. So the campaign started recently. What are you asking the government to do in this campaign?
Well, what we're concerned about is that cancer care is being used appears to be being used as a bargaining chip in some of the debt limit negotiations. We understand, and everybody realizes that cancer care is a big budget item in Medicare, and it takes a lot of money to take care of these patients with cancer. But what's being bantered around is a huge cut to reimbursement for taking care of these cancer patients, and it's really something that would unravel the cancer care delivery system in the United States. 19
national organizations, including patient and people like yourself and distributors, have launched this campaign. What can you tell us about what publications they're being listed in? What can you tell us about the campaign here in Washington, D.C.?
Well, the campaign is sort of an outgrowth of the advocacy work that we've been doing for many years. It's really it's mostly being in advertisements in D.C. newspapers and getting grassroots involved in this discussion. It all came about because they were talking about decreasing payments for cancer care by $3 billion. And the people who study this and those of us who are in this business understand that that's just not sustainable.
And when we listen to discussions about different care in the system and dealing with Medicare and Medicaid and so forth and so on, there's never enough money to take care of people who have serious illnesses. So what have you been able to say to your representatives about this move to cut the way they're talking about?
Well, you have to go back a little bit to 2003 when they passed the Medicare Modernization Act. At that time, Medicare changed the way that cancer care was being paid for. They decided to decrease payments for the chemotherapy drugs themselves and to increase payments for actually giving the drugs, the nurse time, the pharmacy time, things like that. Well, the government did a really nice job of decreasing payments for the drugs, but they never got around to increasing payments for the services. In fact, over the past 7 years, Medicare has actually cut payments for chemotherapy services by 35%. And so this has led to an awful lot of cancer clinics around the country being closed. Over the past 3.5 years, 200 clinics have closed in the United States. And as you can imagine, this disproportionately affects clinics that take care of poor people, the elderly, and in rural areas. And it's really been a significant problem.
Do you think your lawmakers are hearing your appeal at all?
Some of them are. We have some people in the House, Mr. Whitfield, Mr. Green in the House, and then Senators Stabenow and Roberts. They've taken the lead, standing up for cancer patients in the United States, and looking to put in legislation that will try to fix some of this. Even Congressman Lance from New Jersey, Leonard Lance, a Republican from New Jersey, recently wrote a letter to the leadership telling them that putting Medicare cuts in for cancer patients is just not sustainable and would ultimately lead to higher costs.
There is an online petition as well. How does that work?
If you go to communityoncology.org, there's an online petition there that can be signed, and that'll be sent to the folks in Congress.
And the publications that you've targeted here in D.C. are the Congressional Quarterly today, the National Journal, Politico, Roll Call, and The Hill. So they ought to be able to see your appeal.
Yeah, we know the ones they read.
Okay. Dr. Patrick Wayne Cobb, past president of the Community Oncology Alliance, thank you for being my guest.
Thank you, Gloria.